Hello guys, today we will learn about an important drug ondansetron. It's an example of anti-emetic drug. Anti-emetic drugs are those drugs which are effective against nausea and vomiting. Ondansetron is antagonist to the 5-hydroxytryptophan receptor or serotonin receptors. Anti-emetic drugs are usually given by oral routes, but ondansetron it can be given by intramuscular route as well. Now about use, ondansetron is potent anti-emetic drug. It's a drug of choice for chemo-induced nausea and vomiting. It was also found useful in post-operative nausea and vomiting, as well as in drug-induced nausea and vomiting. Apart from this, in case of pregnant women, it is used for the treatment of morning sickness. Now about mechanism of its action. It blocks depolarizing action of 5-hydroxytryptophan or serotonin via 5-hydroxytryptophan 3 receptors on vagal afferents, which are present in GIT, chemotrigger zones in medulla oblongata, nucleus tractus, solitarius. Normally, due to cytotoxic drugs or radiations, they cause their action by means of cell damage, and in response to the cell damage from the intestinal mucosa, chemical mediators like 5-hydroxytryptophan are released. These chemical mediators cause the activation of vagal afferents in gut. On the activation of vagal neurons, transmission of emetogenic impulse occurs. Emetogenic impulses are those impulses which can cause vomiting. These transmissions occurs to the chemoreceptor trigger zones and nucleus tractus solitarius, and from them it then goes to the vomiting centers, and after that vomiting by means of vomiting reflex, vomiting occurs. It's normally, but in case of ondansetron, when it is given, its action is it blocks that it blocks the depolarizing action of 5-hydroxytryptophan, and we know that in case of transmission it occurs by means of depolarization actions. Thus, ondansetron blocks the transmission of emetogenic impulse to the higher centers like chemoreceptors, trigger zones, nucleus tractus, solitarius, as well as, and thus vomiting do not occur. Now about side effects. The common side effects of ondansetron are constipation, diarrhea, headache, hypotension, bradycardia. Ondansetron is contraindicated in the treatment of apomorphine-induced nausea and vomiting, because in these patients it increases the risk of hypotension. It's also contraindicatory in the treatment of motion sickness.
Assalamu alaikum. My name is Asif Jamal. I am a student of Osh International Medical University, Group 2B. Today my topic on drugs. The first drugs are opioids. Opioids are drugs which bind to a specific opioid receptor present in our CNS, central nervous system, and gastrointestinal tract. Heroin, commonly called smack, chemically diacetyl morphine, which is a white, odorless, bitter crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant, that is Papaver somniferum, generally taken by snorting and injection. Heroin is a depressant and slow down body function, and the other drugs are cannabinoids. Cannabinoids are a group of chemicals which interact with cannabinoid receptor, and these receptors present in the brain. Natural cannabinoids are obtained from the inflorescence of plant Cannabis sativa. The flower, top, leaf, and resin of cannabis plant are used in various combinations to produce marijuana, harish, cherash, ganja, generally taken by inhalation and oral injection. These are known for their effect on cardiovascular system of the body. Thanks.
Today my topic is about diclofenac, the most commonly used non-steroid anti-inflammatory drug. First of all, we will see various actions of diclofenac. It is used as analgesic, antipyretic, and anti-inflammatory. It is because of its inhibition of cyclooxygenase enzyme. It reduces intracellular concentration of arachidonic acid in the leukocytes, and it is more effective and have commonly used non-steroid anti-inflammatory drug than others, some selectively for COX-2, no antiplatelet effect like low dose aspirin, so there is no cardiac protection. uh, when it is given orally, oral absorption, rapid and complete, peak plasma concentration achieves in 2 hours, plasma protein binding about 99%, half life is just 1 to 2 hours, duration of action significantly longer due to accumulation of synovial fluid. It will be excreted in the bile. Uh, Now, therapeutic uses, where we can use diclofenac in orthopedic conditions, 100 to 200 mg. We can use the diclofenac in rheumatoid arthritis, osteoarthritis, ankylosing spondylitis. It will get accumulated in the synovial fluid. Thank you.
Hello guys, myself Arslan Iqbal. I am second year students, Group 2B, Osh International Medical University. Today I am going to tell you about cyproheptadine hydrochloride. It is tablets and also came into a syrup. It is 4 mg tablets. Is a serotonin and histamine antagonist with anticholinergic and sedative properties. It is also antihistamine with antipyretic, which is anti-allergic such used to treat such as condition dermatitis, including neurodermatitis, eczema, and etc. Its indication is it's generally used for treating various type of allergic reaction and skin manifestation of allergic reaction. Sneezing, watery eyes, and block or runny nose caused by an allergy, conjunctiva caused by an allergy with red, watery, inflamed eyes. Its pharmacology. Cyproheptadine is a serotonin and histamine antagonist with anticholinergic and sedative effects. Anti-serotonin and antihistamine drugs, anti-serotonin and histamine respectively, for receptor sites. Now its metabolism. If we give after a single 4 mg oral dose of cyproheptadine in HCl, normal subjects given as tablets, 2 to 20% of radioactivity was excreted, 34% of the stool radioactive was unchanged drug. Now its precaution. Cyproheptadine has an atropine-like action, therefore should be used with caution with patient with history of bronchial asthma, increased intraocular cardiovascular disease, and hypertension. Now its adverse drug effect: heart and circulation, feeling like you have missed heartbeat, increased heart rate and palpitation, and nosebleeds. Now it's storage. We have to store this in cool, dry, and dark place, protect from direct sunlight. So that's it about my topic. Thank you.
My name is Tasin Haidar, Group 2B, a student of OS International Medical University. First, we are discussing drugs for cough, two types, dry cough and productive cough. Dry cough, no formation, sputum production. Productive cough, sputum production. First, we are discussing dry cough. First, opioids, codeine, phencodeine, levofloxacin. Adverse effect: sedation, constipation, and abuse. Chances of respiratory depression. Not used in children. Other drugs: NMDA antagonist. Drugs name dextromethorphan. No or less sedation, abuse, respiratory depression. This drug is used in children. Dextromethorphan. When we give codeine plus dextromethorphan, this combination is produced irrational. Third, benzonatate, local anesthesis, central mechanism or peripheral lung stress receptor. Central mechanism to suppress cough. That's all. This is the drug for dry cough.